see cases with mild, moderate, and severe Lassa. For those mild cases, are the ones that usually come down with malaria-like symptoms, which includes they are cold, they have body pain, they're having fever, and they are treating at that point in time, but they think it's just probably malaria. But at the end of the day, after doing that, they still get ill. The fever still persists. And this time, we're looking at moderate symptoms. They are nauseated, they are vomiting, they are quite irritable. Even that fever still persists. And it's now progressed to severe case or even the critical case. And there are symptoms which includes they have seizures, they are unconscious, they are passing blood in urine, they also have poor-colored urine. At this time, the kidney is involved, the brain is involved, different organs actually involved.
Lassa fever seems to be a complex disease. The virus enters almost all kinds of human cells that we know, but we don't really know what kind of pathology it causes in the organs. Clinically, we see acute kidney failure, we see hepatitis, and in some patients also neurological disease, where we suspect that the virus enters the central nervous system. To find out what actually the pathomechanisms behind this infection is, we're doing the MITS study, where we collect post-mortem samples via ultrasound-guided biopsies and then subject these tissues to further analysis. And we hope that by doing that we can find out if Lassa fever is actually a disease hallmarked by hyperinflammation that might be also treatable with anti-inflammatory and host-directed therapies, or if we see more viral, direct viral effects, or actually pathology that's rather driven by endothelial pathology, coagulopathy, or a combination of such methods.
The meat, minimal-invasive tissue sampling, has some advantage over the conventional autopsy. We use an ultrasound guide to take samples using needle biopsies, and there's no form of disfigurement. And apart from that too, the issue of a spread of the organism is also minimized, and the issue of accidents at autopsies are minimized close to zero. Now, before we do that, also the relatives have to, be consented, and consent is informed consent. There's no coaxing, there's no incentive. At any point in time, they can also withdraw their consent. In addition, families also benefit in the sense that they could get the knowledge of what killed their cause of death. There may be organs that are affected that people don't know up till now. Now we'll be able to see that concretely on the histology that we are going to do. So the knowledge itself that is going to come will benefit both the relatives, the health system, and the world at large.
At the end of the day, we believe the result study will help to improve patient care in ISTH and worldwide. We are grateful to our collaborators, who we have been working with for the past 15, 17 years. BNI Germany, Hamburg, UKE, Hamburg. We are grateful for our collaboration, and we actually work together as real partners, not trying to undermine each other. We believe in tenets of collaboration, and that's what has brought us to today. We have been involved with several studies. Anything that we think can improve patient welfare is what we invest time, money, or for the sake of mankind.
Conventional autopsies remain the gold standard for studying how diseases affect different organs. However, for highly infectious diseases, minimal-invasive tissue sampling is a fantastic alternative, which we established at our institute during the COVID-19 pandemic. We are using ultrasound imaging and thin biopsy needles to obtain samples from specific organs. we are regularly inviting experts to further train our own staff as well as our Nigerian colleagues in advanced MITS techniques.
I've received all my procedure training here in Hamburg, and I come regularly to develop it further. In Nigeria, we are currently building a new Lassa ward with our German partners, which also houses a room for our MITS procedure. Sometime in the future, we might also be able to extend the project to be able to use it for conventional autopsies.
We've been collaborating with the BNI team for close to 20 years, and we've done quite a few research projects. But I think the NICS is really one of the iconic ones. It's iconic for many reasons. This is the first time really for very or highly infectious diseases that we're trying to look at tissues. And the truth is that when we're able to see the pathologies in the tissues, then we actually know what's going on inside our patients. And this can help us plan better for their treatment. For example, I work with pregnant women, and Lassa is very severe in patients, in pregnant women. There's a lot of mortality both in the woman and the unborn child. I think a lot of things are going on in the placenta. And the MIT study offers us an opportunity to closely look at what's happening at the placenta bed. And some of the preliminary findings suggest that there's a lot we can do to get better outcomes for mothers and for babies.
Unfortunately, since the disease was first reported about 55 years ago, that was in 1969, we've continued to have yearly outbreak with seasonal surge. Also, it's been estimated that over 37.7 million people living in 14 West Africa sub-region are at risk of developing the disease every year, and accounting for over 5,000 to 60,000 deaths every year, which is quite high. Yeah, but we are moving towards having to understand the disease better and reduce the disease burden, and of course, reduce the case fatality from 2-digit figure through 1-digit figure, and even target a 0 case fatality rate. So there is therefore need to understand the disease better, because up till now, the pathogenesis of disease is still not very clear.
So the collaborative aspect in these studies is very important. We are learning from each other. For us, it's a great opportunity to learn from the Nigerian expertise in the management of VHF patients, Lassa fever patients in particular, and also the work in the isolation ward. And I think we can contribute expertise in clinical management, intensive care management, and also laboratory and capacity support.